Hi, my name is Johnny and I'm a pharmacist working in the heart team in Wrexham Myler Hospital. I'd like to tell you a little about the medication that you are taking for your heart. Before I do so, I must emphasise that you must discuss your heart medicines with your GP or specialist team before reducing or stopping any of them. The benefits of taking these medicines may not always be obvious, but stopping them may have serious consequences for your health. Having said that important point, may I now talk about the different groups of medicines that you may be prescribed. If you've had a heart attack or a stroke, or if you are more at risk of having one, you will have been asked to take a medicine to thin your blood, which will stop any blockages to the small blood vessels that feed your heart and brain. All of these medications may increase the risk of bleeding because of the way that they work in your body. If you do experience excessive bruising, darker stools, or any signs of bleeding, please discuss this with your GP as soon as possible. Some medicines interact in your body with others. When you are first prescribed these medicines, your prescriber will check if there are any potential problems with the other medications that you are taking. If you want to use any over-the-counter medications or herbal remedies, always check with a GP or with your pharmacist to make sure that this is safe. When you are first prescribed these medicines, it is important for you to check how long that you will need to take them for. Your GP can also provide this information for you. This has already been touched on in another talk, but high cholesterol can increase your risk of heart attacks or strokes. The main group of medicines that patients are prescribed for this are the statins, for example atorvastatin or simvastatin. Simvastatin is best taken at night when your body makes most of its own cholesterol, but atorvastatin is longer acting, so you may take this at any time of day. Statins reduce certain bad forms of cholesterol, which keeps the blood vessels in your body clear and healthy. These medicines must be taken daily for life unless otherwise instructed by a medicine prescriber, whilst maintaining a healthy diet and exercise program and stopping smoking. Occasionally your prescriber will change the dosage or ask you to temporarily pause these medicines if you are prescribed other medicines which interact with them. Please ask your pharmacist about this when you are started on a new medicine, such as a course of antibiotics. Statins are generally very well tolerated and cause few real side effects in most people. If you do feel that you have an adverse effect from taking them, please discuss this with a pharmacist or your specialist first. Again, your GP will need to check a liver blood test periodically to prove that they are not causing any problems. If you have unexplained severe aches or pains in your body, please discuss this with them. Sometimes, if statins do not suit you, you may be given an alternative cholesterol-lowering medicine, such as ezetimibe. But if you have poorly controlled cholesterol, ezetimibe may be given with a statin after more specialist advice has been given. Another group of medications you may start on is a beta blocker. Examples of these include bisoprolol, nebivolol or carvedilol. They all end in the word part olol. These medications have been prescribed to slow the heart down, to make it work less hard, and so in turn to allow the heart chambers to open up as much as possible to fully fill before they squeeze the blood around your body. This allows the heart to be a better pump of blood around the body, and it also can enable heart muscle to be less tired, reducing the risk of angina. Most beta blockers are very well tolerated as they are very specific to the heart. But some people have their beta blockers changed to a more heart-specific one. Calcium channel blockers such as diltiazem or verapamil can be helpful alternatives in people that are unable to take beta blockers. These medications work in a similar way to beta blockers. However, they are not suitable for someone with a heart condition where there is a reduced heart pump. These medications help control blood pressure as well as reducing the pressure the heart is under. This means the heart can squeeze better with more spring, enabling the heart to be a better pump. Some people describe this as giving the heart more ping to spring closed tighter as it squeezes the blood around your body. The dose of this is always started low, then built up slowly whilst healthcare professionals monitor your blood pressure and blood tests. You will need to have a check of your kidney blood tests every 6 months while you are still taking these medicines. Examples of ACE inhibitors include ramipril or lisinopril. When an ACE inhibitor is started, you may be told to watch for any persistent, dry, non-productive cough, and if this becomes troublesome, disturbing your sleep at night, for example, then your healthcare prescriber may consider using an ARB, also known as a sartan, such as candesartan, as an alternative instead. Both ACE inhibitors or sartans require frequent kidney blood test monitoring, so it is useful for you to remember or to set a reminder on your calendar when to expect that these blood tests will be due from your GP. If you have not had a kidney blood test in the last 6 months, ask your GP practice about this. These are a specific type of medicine that will be prescribed for you if your heart pump is weaker. There are only 2 types in the UK, spironolactone or eplerenone. Both these medicines help to control the amount of fluid in your body whilst protecting your heart. It is important to note that they are not a water tablet, and you'll be asked to take these medicines continually. If you are on one, you will need kidney blood tests every 3 months from your GP. As they may cause stomach upsets, they are best taken after a meal. Also known as water tablets, diuretics will be prescribed if you have too much water in the wrong places of your body. They work by making you increase how much urine that you need to pass. Often this effect will be within 30 minutes of taking a tablet, and they may be effective for up to 6 hours later, so the best time to take these is in the morning. Your specialist or GP may increase or decrease the dose or even stop these depending on how much fluid that they see, what your symptoms are, or what your blood test results say. Again, always take your medicines as they have been prescribed to you and only change these on the instructions of a qualified medical professional looking after your care. If you become unwell, it is important to make sure that you know what to do with your medicines. If you become unwell with diarrhea or vomiting, or if you have a high body temperature or fever, or for some reason that you cannot keep your usual fluid intake because of an illness, you should withhold your ACE inhibitor or sartan and MRA and seek medical advice from your GP or specialist, and only restart these if you are well enough again, or if specialist advice has been given. All of the medicines discussed so far are prescription-only medicines. That means that your GP will have a record of all of these medicines that they prescribe, or of other medicines that have been prescribed or provided for you. Some medicines may be bought in shops or in community pharmacies. There is also a rise in the number of medicines sold over the internet, but I would advise against these as they may not be of the quality or safety as other medicines. Before starting a new medicine or herbal remedy, always ask your pharmacist or prescriber if it is safe to do so. For example, over-the-counter ibuprofen or aspirin may cause an increased risk of bleeding or kidney problems with the medicines that we have already mentioned. And whilst paracetamol is generally safe, soluble forms have a lot of sodium, like salt, in them, so the safest thing is to ask first. Sometimes medicines are given for similar heart conditions such as angina or high blood pressure, so this talk is by no means an exhaustive list. You may always ask further questions about these. More information about your medicines may be found from the British Heart Foundation or Pumping Marvellous websites. Thank you for listening.